Good evening, everyone. Hope you all are doing well. In today's session, we are going to look at the 2025 updates, which were recently published in the Lancet Journal of Diabetes and Endocrinology, looking at the topic of defining and classifying obesity into clinical and preclinical obesity. And here we are going to go through the new diagnostic criteria proposed in this. And also, we'll look at how we should look at our patients in terms of looking beyond the BMI rather than just classifying them as overweight or obese based on the BMI. Try to define what is preclinical as well as what is clinical obesity. Of course, it's a very important topic for our clinical practice as well as across various exams. This is the lecture number 92 of my lecture series, which is a very extensive lecture series covering the entire scope of exams for specialty certificate exam, European board exam, MRCP, as well as the Saudi Endocrine Fellowship exams and endocrinology board exams across the world. As I mentioned in my lecture series, I have covered different sections of endocrinology and diabetes. There are several lectures on thyroid, several topics of adrenal, pituitary. I've covered almost all the Joint British Diabetic Society and the NICE guidelines by all case-based approaches, which is a very important section for the exams. Lectures on calcium and bone regulation, high yield lectures which are involving the previous exam recalls and high yield topics, even from the Oxford Handbook and exam labs as well. Then lectures on reproductive system, and the lectures on lab endocrinology and the genetic syndromes alongside lipid metabolism and immune checkpoint inhibitors as well. So let's start straight away with our patient case one. Patient named Alex, 35-year-old, BMI of 32 kilogram per meter square. So if we look at our old classification, which we are aware of, this will be graded as obesity or obesity grade 1. Waist circumference was measured for this patient, and that was found to be 98 centimeters, which is considered high risk for men. We'll be looking at all this in terms of how to grade the risk for the waist circumference in the subsequent slides. In terms of the medical history, the patient has no diagnosis of hypertension, diabetes, or other obesity related comorbidities, reports feeling generally healthy and active, enjoys hiking 3 times a week, no limitation in daily activities. So here we have a 35-year-old man who has a high BMI of 32, which is an obesity grade 1. He has a high waist circumference and he defines no significant comorbidities from the obesity or other chronic conditions. So how will we define or what will we label this patient? Should we label this patient as being just obese, or do we have a new definition? That we'll be looking at in the explanation. So diagnosing clinical obesity has limitations, and currently we are just diagnosing the patients on the basis of BMI. So with a BMI of under 18.5, we label the patients as underweight. 18.5 to 24.9, we label them as normal. BMI, overweight is 25 to 29.9, and obesity we define, which is any BMI more than 30. Now, BMI may be a useful measure for identifying individuals at increased risk of health consequences. However, it is definitely not a direct measure for fat. It does not establish the distribution of fat around the body. What if the patient is muscular and the weight is usually muscle mass? Again, it cannot determine whether the excess body fat is a health problem for the patient, whether it is causing the patient any bad health consequences. So relying on BMI alone to establish if someone has obesity is problematic, and this can inaccurately classify a person as having or not having excess body fat, and this can lead to underdiagnosis and at times overdiagnosis of obesity. So underdiagnosis of obesity in people who are already having impairment of the health, and may lead to overdiagnosis of obesity in some healthy individuals as well who are muscular in nature. So now looking at this particular scenarios. So, for example, for the patient number labeled as 1, the BMI is 28.2. Traditionally, we'll label the patient as overweight. But does the patient have excess body fat? Yes. If the patient has any signs and symptoms related to obesity, this will look at in the subsequent slide. What is the meaning of this? In this case, which is case number 1, the patient does not have any signs and symptoms of obesity. On the basis of this, it is such a patient who has been labeled as overweight plus has excess body fat but does not have any signs and symptoms related to obesity may still have an underdiagnosis of obesity because the obesity is not causing him any clinical impairment or not limiting his daily activities, and hence such a patient who has an excess body fat with being labeled as BMI being overweight is underdiagnosed in terms of obesity because he does not have any signs and symptoms from this obesity. On the other hand, if you have a patient with a high BMI of more than 30 labeled as obese, but he does not have excess body fat and he does not have any signs and symptoms related to obesity, still we diagnose the patient as obese because the BMI is more than 30. Now, this is overdiagnosis of obesity. What if the patient is obese with a clear BMI very high of 36 with excess body fat? Yes. And having no signs and symptoms related to obesity, such a patient will be labeled as obesity with preserved health. On the other hand, if patient has all the problems from the obesity and the signs and symptoms related to obesity alongside an excess body fat, such a patient will be labeled as obesity with ongoing illness. Now, what are the limitations of this BMI based diagnosis? So, people with excess body fat do not always have a BMI above 30, meaning that their health risk can go unnoticed, as the case scenario 1. What about the case scenario 2 here? Individual with a high muscle mass, example athletes, tend to have a high BMI, so they don't have excess body fat, they don't have signs and symptoms of obesity, and they are just overdiagnosed as being obese. So, diagnosis of obesity in such an individual who is an athlete with high muscular mass is inappropriate. On the other, the last two scenarios, which is case 3 and 4 for this particular patient types. So, some people with excess body fat and high BMI can nevertheless maintain their normal organ function and have an unhindered ability to conduct daily activities. Hence, they have no illness or no physical impairment from the obesity. On the other hand, others may manifest objective evidence of ongoing illness. So, in these cases, we are just currently labeling the patient as obesity with preserved health, and we are labeling the patient as obesity with ongoing illness. But now we'll be looking in the next subsequent slides how we can define these patients into the new classification of preclinical and clinical obesity. So, very importantly, now I kept repeating a statement of signs and symptoms of obesity. Now, this is what we'll be looking at in this particular slide. So, the new classification is how we label the patients as having a preclinical obesity and clinical obesity. So, this is a more accurate and a clinically relevant approach. So, this was proposed recently in the 2025 update. So, preclinical obesity, it is defined as a condition of excess body fat associated with variable level of health risk, but patient has no ongoing illness. So, basically, obesity with preserved health, but defined as now preclinical obesity. So, these patients have no evidence of reduced organ or tissue function due to obesity, can complete day-to-day activities unhindered, and of course, they are generally at higher risk of developing diseases such as cardiovascular disease, some cancers, type 2 diabetes, clinical obesity. They're also at risk of clinical obesity. But currently, at that moment, they have no evidence of reduced organ or tissue function due to obesity. Hence, they are labeled as preclinical obesity. Now, this can progress to clinical obesity, which is basically a chronic disease due to obesity alone and characterized by signs and symptoms of organ dysfunction and or reduced ability to conduct daily activities. So, patients with clinical obesity has been defined as those having reduced tissue or organ function due to obesity, such as breathlessness, which is caused by effect of obesity on the heart and the lungs, knee or the hip pain, which is joint stiffness, and reduced range of motion. So, all these are signs and symptoms which I was referring to you in the previous slide. They may have a cluster of metabolic abnormalities like hypertension, diabetes. They may have also dysfunction of other organs, including kidneys, upper airways, nervous system, urinary and reproductive systems. So when there is alteration of organ function, this is defined as clinical obesity. When there is excess body fat, but not yet any alteration of the organ structure, this is defined as preclinical obesity. So very simple, the new definition which we should imply now in our clinical practice, preclinical obesity and clinical obesity. Now, we'll try to put in this chart the two methods and see how we can look at the traditional measurement of obesity versus the new diagnostic method. So just we'll look at first case number one. Here BMI is 23.7. Normally we'll label this patient as having a normal BMI. Excess body fat? No. Muscle mass? Normal to high. Signs and symptoms of obesity? No. This is simply no obesity, and even in the new diagnosis, it will be labeled as no obesity. Now look at BMI 28.8. In the old classification, we will label the patient as overweight. Excess body fat? No. Muscle mass? Normal. Signs and symptoms of obesity? No. Simply label the patient as overweight in the old classification, but in the new classification, the patient will be classed as having no obesity. What about BMI of 28.8 in this patient number 3? Has excess body fat? We'll be looking at what are the measures of excess body fat, by the way, in the subsequent slides. Yes. Normal muscle mass? Yes. Normal to low. Signs and symptoms of obesity? No. So this patient is having a high BMI with excess body fat. In the old classification, we'll just label the patient as overweight, but in the new classification, we'll call this patient having a preclinical obesity. What about BMI 32.4? Obese in the old classification. This the patient has excess body fat. This case patient 4. No. Muscle mass is high. The patient is an athlete. Signs and symptoms of obesity? No. So in the old classification, we'll label this patient as obese, but actually in the new classification, this patient has got no obesity. What about patient scenario 5? We have a very high BMI, 39.2. Excess body fat, yes. Muscle mass, normal to low. Signs and symptoms of obesity, no. And the patient in the old classification will be labeled as obesity, whereas in the new classification, the patient will be labeled as preclinical obesity, even though he has a BMI of 39.2. Now, BMI of 39.2, excess body fat, yes. Muscle mass, normal to low. Signs and symptoms of obesity, yes. Old classification patient labeled as obesity, new classification patient definitely labeled as clinical obesity. So this summarizes all what we discussed in the previous slide. Now, what are the measures of diagnosis of diagnosis of this clinical and preclinical obesity? What is the measure of this excess body fat, what we are talking about? So the first step in such a diagnosis is by confirming the excess body fat, which can be achieved via one of the following criteria. So at least one of the sizes measurement of the body size, what they are referring to is either we do a waist circumference or a waist to height ratio or the waist to the hip ratio alongside BMI. The other way is at least two measurements of the body size, like at least two of the things which I mentioned, regardless of the BMI. Or we can do a direct fat assessment or measurement using a DEXA scan. If there is excessive body fat, then we go down to the chart of obesity. If there is no excessive body fat, there is no obesity. So once we have confirmed that the patient is obese, then we ask the patient the medical history. Are there any signs and symptoms of organ dysfunction, which I mentioned in that previous slide? Does the patient experience any limitation in his day-to-day activities? If the patient has none of these, then it is preclinical obesity. On the other hand, if the patient has limitation of day-to-day activities, has signs and symptoms of organ dysfunction, it's labeled as clinical obesity. So based on this new framework, our patient in case scenario 1, we'll be totally discussing 3 case scenarios in this presentation. This was the case number 1. So patient has got preclinical obesity. While BMI is in the obese range of a patient and the waist circumference indicates increased adiposity, there is currently no reported organ dysfunction or limitations. Hence, the patient is defined as having preclinical obesity. So management approach in this patient will be dietary modification, of course, increase physical activity, regular monitoring for any development of complications like checking for blood pressure, glucose, lipid profile, education on the potential health risks associated with excess adiposity and the importance of maintaining a healthy lifestyle. And of course, we should discuss the patient, the weight maintenance goals and weight loss goals as well. And that's the end of my preview. If you like to subscribe to my full session, I'll be describing two other case scenarios. Plus, I will be going through how do we take the measurement for the waist circumference, how we'll be taking the measurement for the waist and the height ratio, and how we'll be taking the measurement for the waist to the hip ratio as well. Plus, we'll be looking at two other case scenarios. So if you like to have an access to my full session, this is my lecture number 92 of my lecture series. Please subscribe to my lecture series. You can email me or WhatsApp me and I'll let you know the subscription details. Thank you so much for listening.